Hi everyone, we're back again to answer more questions. These have come from my website and I'm joined as usual by Barbara, who's going to throw those at me.
Okay, our first question is from Andrew. What procedure would correct my elevated eyebrows? Great question from a guy, I think.
Interesting, yeah. A male 42-year-old with an elevated eyebrow. So why has he got elevated eyebrows? Has he had Botox? Is this a result of a Botox treatment? Because you do see this where it's overdone. And if that's the case, there's not much you can do at this stage except to let the Botox wear off. If it's due to other reasons, then you can use Botox in a specific area up here to bring down the eyebrow. But generally, we're not looking to do that most of the time because usually we're looking for elevation, because usually as we get older, we get brow ptosis and we want to open up the eyes so you look fresher and younger. So I'd like to know why, more specifically, why they have an elevated eyebrow. Is it on one side? Is it a result of treatment? Are there other reasons for that?
Well, I have a feeling, I know it's not clear, but we've had questions before where one eyebrow is elevated and the other one isn't. I think he just doesn't like his elevated eyebrows.
Yeah.
I don't think it's done. It doesn't sound like he had Botox.
Yeah, okay, because that's also, it's not common, but you do see asymmetry in patients where one eyebrow will be higher than the other. And again, that's something you can correct that by using Botox. You can also see these sorts of things happen where someone's had an accident and they've had some nerve damage. And maybe the other side has dropped, and so the other side appears elevated. So there are a lot of reasons as to why that appearance of an elevated eyebrow. The reasons why behind that is the important thing to.
Besides the fact that if you don't like it, I mean, there's a lot of reasons.
You need to understand what's going on.
Yes, good. Lizzie wants to know what procedure would minimize the appearance of laugh lines. She's 42.
42 and doesn't like her laughter lines. Why?
Well,
again, I think, a lot of this comes down to assessment because we all have different facial shapes. So, if you have a thin face, then you're going to see more of the laughter lines. If you've had a fuller face, you're going to see less. But as we get older, we tend to have soft tissue that tends to fall down. And that will contribute to some of this. If you're a very expressional person, you're laughing all the time, then obviously you're going to see these lines. If you are treating the laughter lines and it's purely a direct treatment, you can do this by using a very fine filler because you don't want to create a sort of chipmunk look. And if we're talking about these laughter lines here, if she's 42 years old, I'm also thinking that has she had any volume loss elsewhere? Has she had any herniation of soft tissue? Is it descending? So these will all contribute to these laughter lines as well. So again, I think that fillers usually are the correct procedure in this area. Certainly not Botox, but you need to find out what the cause is.
Again, what the cause is. Okay, I love this question. Janet is 64 years old and wants to know how she can treat her bulging veins after temple filler. She had temple filler for the first time 5 months ago. Her temple veins bulged following the procedure, and she was told that was normal. It's been nearly 5 months since her procedure, and although the bulging decreased, she still has bulging veins. Is this normal?
Well, I have seen that. I have seen where filler has been placed, typically in this temporal area, and that will create a bulging vein because of the pressure on that.
Are we talking like bulging, or
so
is
you can
like
get people talk about pipes, or you may have a vein here that becomes more prominent. And typically what's happened is the filler has caused some compression on the vein, so it becomes more engorged, if you like. It doesn't drain so easily. So in her particular case, she's had a filler 5 months ago. She's probably had a very thick filler, so that means it's going to last a long time. So her best bet really is to allow this to naturally dissolve, and it may take 12 months, it may take 18 months. It's not usually a good idea unless it really, really bothers her to start dissolving this.
Okay, now that's advice for Janet. However, my friends and I, because we're mature, start to lose volume around the temple area. And everybody is going to get filler in that area. What advice can you give me and my friends who are getting temple fillers? Because this is a big deal.
And I do a lot of temple filling because it's something you see as we get older. We hollow out here, and I think unfortunately for the ladies it's more obvious because typically you have a very convex surface here, whereas in the male it's more square, so when we start to lose volume it's not so obvious. There are different techniques for treating this area. Typically I would use a deep filler because I really want to create volume from beneath, and it gives in my opinion, it gives a better result. But you do have to be very careful. There are arteries, vessels and things around there, so you have to have the correct technique, a safe technique, to make sure you're not injecting in or even close to vessels.
So what should you discuss on your consultation with your doctor?
I was going to say, the other thing you can do is you can use a finer filler in a superficial plane. And typically that's what a lot of people will tend to do, especially if they're unsure about the anatomy in that area.
So that's not bad.
That's not bad. So, I mean, in this particular case, if one is concerned about that, then you might opt for that more superficial filler.
So what should you discuss with your doctor when you go and say, oh, I'm not really happy with my loss of volume around my temple? You should ask him something.
Well,
what are the questions?
The important thing really is to have the assessment. The doctor should be, or the practitioner should be, assessing this area. You sometimes can feel whether the artery is pulsating or not. So there's a variation in anatomy. The other thing is, if you're going to use fill in that area, typically in the deep plane, build it up slowly. So don't put a lot in. You get a much better result if you put, I usually use no more than half a syringe in one temple at one session. I have come across patients that have had much more than that. I don't think that's a particularly safe way to approach treating the temple area. But, you know, if you do things gradually and you build them up gradually, generally you get a better result, and it will still last a long time.
And you're happier.
And then you maintain it. And then you're just putting small amounts in to maintain that result. You know, maybe you're doing that every 9 months or a year.
Well, ladies, that's the best advice, I think. Do it gradually.
Yeah.
Okay, Janine is 28 years old, and she's looking for advice on how to best balance her features. She's concerned about her flat face, double chin, which she feels is a weak chin, and she feels it's sagging. She has not had any drastic weight loss. What do you suggest?
So we touched on that on an earlier question. So the double chin with a flat face, where you've lost the volume and it's descended, contributes to a double chin. Not always, but it will contribute to that chin. So again, you're looking to restore some of the volume and lift in this area, which in itself may correct some of the double chin. Having said that, if there's a limitation as to how much you can treat the double chin, and you may have to look at another procedure, such as cryotherapy or a liposuction or a vaser technique. But for the flat face, typically that's where you're going to be using fillers. And again, How old is she again?
She's 28.
That's young. So typically, you're gonna. We don't know. Is she thin? Has she lost weight? Because
She hasn't. She
no,
has not had any drastic weight loss.
no. But I do see that in patients too. And so, when we're using fillers, we have to assess each patient individually because you may be putting some filler in the deep plane and you may be using it in the superficial plane as well. And again, if you're doing this, I always do it slowly, gradually, small amounts, because it's easy to overdo things. And then when they animate or they smile, it becomes more noticeable, that they've had treatment. So
good advice. This is from Charlotte. She's concerned that she's already forming jowls in her lower face, and she's only 26. Which treatment would you recommend for this area? This seems to be a question that comes up a lot.
Jowls in a 28, you say? 26-year-old, that's very unusual. And again, I think we're going back to a thorough assessment. Has she lost weight? What's causing this? Because typically it's coming usually from the mid face with results on the lower face, this jowl area. We talked about using fillers to lift this area. You can use fillers to contour this area. There are also energy devices that one should consider, I think particularly in that age, where you're going to tighten the skin and the subcutaneous layers. So there's a number of options that one can use to treat the jowls in a younger person, as much as they are in the older person as well, actually.
Yeah, and that's it.
That's it. So thank you, Barbara. If you have any more questions, please go to my website. There's an email there where you can submit those. Thank you.